Over the next few minutes, I want to discuss a new laboratory procedure that we have recently made available that will make Powerprox 6-month braces even more predictable and even easier to provide for your patients. It is the new Powerprox 6-month braces digital setup and Reprox guide, and it will tell you both the amount and the location of Reprox needed. Simply send your impressions or poured models to the lab, and they transform them into digital models. The lab provides you the viewing software free of charge and will email the digital models to you. You can view and store the models on your own computers. There is no more need to store poured stone models in your office. The lab will take the original malocclusion model and will use the Powerprox 6-month braces treatment planning concept of beginning with the end in mind. They will perform a digital reset to move the teeth to the ideal positions, the same way we will move the teeth using shape memory nickel titanium arch wires. Here you can see a comparison of the before malocclusion model and the after digitally reset model. Now here comes the really cool part. The software calculates the tooth movements needed to go from the before model to the after model and tells us the amount and location of the tooth collisions to get there. In other words, the software tells us the amount and location of the Reprox needed to align the teeth within ideal arch form. How cool is that? This is done for both the upper and lower arches, and this can really help eliminate some of the guesswork involved in performing Reprox on your Powerprox 6-month braces cases. Now, to make Powerprox 6-month braces even more turnkey, you can bundle the digital setup and Reprox guide with our other laboratory services. Indirect bonding trays with clear brackets, the Powerprox 6-month braces cephalometric analysis, and the individual patient system. You can get expert-made, customized indirect bracket bonding trays from the lab. They can make the trays from the same impression you sent in for the digital setup and Reprox guide. Many doctors love these trays as a way to streamline the initial bracketing appointment and make it a very fast way to get those tooth-colored brackets placed in the ideal positions quickly and predictably. Here's a short video to show you the customized indirect bracket bonding trays, how they're used chairside when treating your patients. After isolating and etching the teeth, the bonding agent is placed. Simultaneously, the orthodontic cement is being placed on the back of the brackets, which are inside the indirect bracket bonding tray. Then the tray is simply seated onto the patient's teeth and held in place to cure. Here we are seating another tray section. You can see how the tray snaps perfectly into position. It is simply held in place and the cement is cured. Next, we peel off the trays. I like to use a sickle scaler to remove the hard tray first, and then we tease the soft tray off a tooth at a time, leaving the brackets in place on the teeth. As you can see, indirect bonding trays allow you to quickly place clear brackets in the ideal positions. For those who use the Powerprox 6-month braces cephalometric analysis, you can prescribe that in your bundle as well. The available individual patient system includes the items you need to treat a single patient with Powerprox 6-month braces. You have arch wires, orthodontic cement and bonding agents, Reprox disc, and diamond strip, plus all of the ligation auxiliaries typically used when treating your patients. To recap, the available laboratory service for Powerprox 6-month braces, we have digital models, the Reprox guide, indirect bracket bonding trays, a cephalometric analysis, and an individual patient system. You can order any of these individually, or you can bundle them together in various combinations to suit your needs. To learn more about the affordable fees for these services, to download laboratory prescriptions and mailing labels, please visit 6monthbraces.com/PowerproxLab. And please remember, we do not have any minimum case requirements or quotas for you to use these services.